Thank you all for coming this afternoon to our Medicare 101 workshop. My name is Ron Owen. I'm the benefits guy here at the college. And I want to introduce a couple of people. First of all, Lola Nickel from CISC, Self-Insured School of California. They're our benefits administrator. And Susan Pope from Keenan. They're our benefits broker. I'm going to let them introduce the other guests today.
All right, so as they all walk in the door. So at CISC we have a dedicated Kaiser service team, and then they've also brought in additional resources. So Maria Harlan is the Medicare specialist with Kaiser Permanente. I think she has a much more glamorous title than I just gave her, but she is the guru for all things Medicare. She's been working on our account for, what, 12, 13 years now? Something like that?
Time to retire.
Yes. She flew up from Burbank this morning, so I'm super excited to have her joining us. Also, from a little bit closer, we have Cassidy Clifton from Kaiser's Walnut Creek area, and then we also have Angela Moran-Sonoma. Thank you so much. So with that, I'm going to go ahead and let Maria take it over.
Before we start, we just want to let you know that CalSTRS is here also. They couldn't get CalPERS to come, unfortunately. Very sorry about that, but CalSTRS is here. So please make sure that you get to know him and ask him questions about your retirement if it pertains to you.
Is he outside?
He is outside. So when you leave, if you have any questions, we can also bring him in at the very end to ask a few questions.
And so just a clarification, you each have this handout, and it's the same as the one that is the note version. Sorry about the duplication. We didn't coordinate all that well, but that way you have plenty of room to take notes. And Maria, as she works for Kaiser, this is a general Medicare presentation, questions that pertain to non-Kaiser. I can work off at the end, but with that I'm going to go ahead and let Maria get going because this can take a bit. And Maria, as far as questions?
Yeah, we'll hold off the questions till the end, so write your questions down as we go through each slide, and we'll address it at the end.
We find that works best because we have at times, Maria and I have found ourselves 2.5 hours later still with the same group. So let's hold the questions.
Do you guys want
to
us
the
to
end.
turn the lights off a little bit so you can see better? Yes? Okay.
All right, so good afternoon. Again, my name is Maria Harlan. I'm a Medicare retiree consultant from Kaiser. I've been asked to come out here to educate you on Medicare. What is Part A, Part B, Part C, Part D of Medicare? How does this work when I retire? What if I retire under the age of 65? What if I retire at age 65? What if I decide to retire post 65? When do I enroll in Medicare? You're going to learn about what the late enrollment penalty is all about and how does it coordinate with my insurance plan once I retire from the college. So how many in the room are actually still working? Anybody? Okay. Anybody retired in the room? Couple? All right, so there's a majority still working. How many think they're going to retire under the age of 65? Okay, anybody retiring? A couple of weeks.
She's having countdown.
How many are going to retire at age 65? Anybody going to retire post 65? All right, so we will talk about when to enroll in Medicare. So you have the copy of this presentation. And again, if you could hold off the questions until the end, because I've been doing this for so many years that I find that your question is going to be answered in the following slides. So we'll just go from there. So 10,000 people a day are turning 65 in the U.S. The baby boomers have arrived. Those born between 1946 and 64 were here, so the government expecting a lot of people enrolling into the Medicare program. So what we're going to do is learn the basics of Medicare. Again, this is Medicare, the general information about Medicare. We'll start on page 3 in terms of defining what is Medicare. Let's figure out this button. Okay. So what is Medicare? Medicare is our federally funded national insurance program that was established back in 1965 under President Lyndon Johnson. And Medicare is administered by CMS, the Centers for Medicare and Medicaid Services. So Johnson signed into law. Who was the first 2 people that received their card when Medicare was signed into law? Anybody know?
George Burns.
George Burns. Good guess. It was President Truman and his wife Bess. And Medicare was signed into law in Independence, Missouri. If you ever want to visit the Truman Library, it's a beautiful library. You'll see the auditorium and the oval table that when Medicare was signed. So if you're traveling after retirement through the Midwest, go visit Truman Library. It's a beautiful library. Okay, so who can join Medicare? Who's eligible for the Medicare program? Most people will be eligible under the first bullet, which is people age 65 or older if they or their spouses are eligible for Social Security. I know some of you may not have paid into Social Security as teachers, but in 1986 you were asked to start paying in, and we'll talk about ways of becoming eligible for Medicare when we get to Part A. But the magic number for Medicare eligibility is age 65. You don't want to confuse it with those that do receive Social Security benefits maybe at age 62 or postpones it after 65, but this is Medicare. 65, signed in 1965, age 65 eligibility. We don't know where Medicare is going to be in about 5 or 10 years. There's always talk about Medicare for all. You know, Congress, we just wait every year to see if there's changes to the program or not. But right now, eligibility in most cases, age 65 or older. But then there are people under the age of 65 because of a disability. And after receiving Social Security disability for 2 years, that person is also eligible for Medicare. Then there's those that are diagnosed with end-stage renal disease, or also known as kidney failure, at any age. They're eligible for Medicare. And they also added Lou Gehrig disease, also known as amyotrophic lateral sclerosis, ALS. Anybody diagnosed with that disease is also eligible for Medicare. So Medicare has 4 parts. There's Part A, Part B, Part C, and Part D. First part is Part A. When you hear Part A under the Medicare program, it means hospital insurance. It helps cover for your inpatient hospital care, skilled nursing, hospice, and home health care. Question is, do I have to pay for Part A? What does it cost me? There is no premium if you or your spouse have worked at least 10 years of Medicare-covered employment, or what is known as 40 quarters. Sometimes right after college, you work for this company, that company, and you're paying the FICA taxes in your paycheck towards the Medicare taxes. So in most cases, if you have 40 quarters, if you don't know how many quarters the system has for you, you can always call Social Security, check on it, because you're retiring in about 3 to 5 years. You just want to know how many quarters do you have in the system. Because if you have 40 quarters by the time you turn 65 and you happen to be retiring at that point, you don't have to pay for Part A. But then for those that don't have enough quarters, let's say I'm turning 65, I want to enroll in Part A, but the Social Security rep is going to say, Maria, you're short. You only have 30 quarters in the system. You can either continue to work until you accumulate 10 more quarters, so you don't have to pay for Part A, or you may be eligible under your spouse or your former spouse. Because if you were married for 10 years and you were divorced, and that spouse is eligible for Medicare, you can qualify under their Social Security number without having to tell them. But there's different ways to be eligible. I mean, you can check with Social Security. Now, if you're 38 quarters, they might say it's $200 a month. But less than 30 quarters, if you want to enroll in Part A today, it's like $437 a month for Part A alone. So Medicare has a formula to determine how much one would pay for Part A, but again, in most cases, you shouldn't need to pay for Part A. If you have personal questions later on, you can ask me about qualifications, because widow, divorce, formerly married, you can qualify under your spouse. And then there's Part B under Medicare, which is considered medical insurance. Part A is hospital, Part B is medical insurance, like your doctor's visits, your labs, your durable medical equipment, your radiology, dialysis, some preventive care services. Everything that doesn't fall under hospital falls under Part B medical insurance. Unfortunately, there is a Part B premium that we all, or most of us, have to pay. So how does the government determine how much I pay for Part B, how much Lola pays for Part B? The government looks at our income tax return with a 2-year look back. So if I was enrolling in Medicare this year, which is 2019, they're looking at my 2017 income tax return to determine, how did Maria file? Did she file as a single, or did she file as a married couple? And were they reporting, below 85,000 as a single or below 170,000 as a couple 2 years ago, right? It's a 2-year look back. Then their Part B this year in 2019 is $135.50 each. If we happen to be both 65 and we're enrolling, we each have to pay a Part B premium. Now, so every year the government releases what they call a Part B premium table. This is the 2019 table. Last year, I believe the standard premium was $134. 2 or 3 years ago it was $96.40. So as you can see, it's kind of increasing every year. So by the time I retire, I don't know how much I'm going to pay for Part B. But you have to plan ahead because every year it'll change because they're always looking at a 2-year look back. So once I'm enrolled in Medicare in 2019, that December of that year, I'll get a letter from Social Security and saying, "Dear Maria, your Part B premium for 2020 will be based on a new table, based on my 2-year look back on 2018. They're looking at my income tax return. Now they determine how much I pay for Part B." So it'll adjust, and if you don't agree with what they're telling you your Part B premium is, just go back to Social Security and say, "I don't understand why you're billing me $460.50 for my Part B premium." Because things do happen where maybe you decide to sell a house or cash in the stocks and bonds, and they look at that in terms of what's happening. It's based on your modified adjusted gross income. So work with your accountant because it is based on your MAGI. Now there are folks that may not be paying as much as you are paying. Many of our parents, been in the Medicare program for many years. They may be grandfathered into what they call a hold harmless provision where they don't increase their premium because of the cost of living adjustment every year. So it depends. So you might say, well, how come this retiree is only paying $104 and I'm paying $135? Again, it's Social Security that determines how much you pay for your Part B premium. Now notice in the right, if you file separately from your spouse and you're making above $85,000, you automatically go to the $433.40 a month for this year. So plan ahead. I think I'll just rent my house over to my daughter around 65. Take over. Okay, so now that's the Part B premium. Now that Part B premium, how do I pay for that Part B premium? In most cases, for those that do collect Social Security benefits, it's deducted from your Social Security check every month. So when you get that letter around December each year, it'll say your new Social Security amount is so-and-so minus Part B premium equals what they give you. Now, if you don't collect Social Security benefits, you can pay for it in different ways. The government will allow you to pay for it by mail. They can bill you every 3 months, quarterly. They don't bill monthly. Or you can ask them to take it out of your checking account or your savings account. For federal members, they take it out of their annuity every month. So it depends. Now, this Medicare program has what they call a late enrollment penalty. So depending if you're going to be retiring at 65 or you're working past age 65 determines if that penalty is applicable to you or not. And what that late enrollment penalty means is that this premium, whatever premium you're paying for, if you're assessed a late enrollment penalty, it goes up 10% for every 12-month period that you decline enrolling into the Medicare program. So I need to demonstrate this a little bit more because that penalty does not apply for those folks in the room that decide, I want to continue to work past the age of 65 and I have group insurance through the college. Then you don't need to enroll in Part B until you decide to retire. So I'm going to demonstrate that a little bit more, but it's called an initial enrollment period and a general enrollment period in terms of how to enroll in Parts A and B. So how do I enroll? When do I enroll? It all depends on your situation. For those of you in the room that decide, I'm going to retire at age 65, or maybe you decide you want to retire before age 65, like Sam here, you have a 7-month window, which is 3 months before your 65th birthday, up to 3 months after, to avoid that late enrollment penalty. So if you're going to be, let's take the folks in the room that decides, I'm retired by the age of 65. If your birthday is in the month of June, for example, you want to start enrolling as early as March because you want your Medicare to be effective your birthday month. If your birthday is in June 15, June 25, your Parts A and B is effective June 1st. Anybody's birthday on the 1st of the month, by any chance? Just in case, if your birthday is in the 1st of the month, it's effective the 1st of the previous month. If my birthday is June 1st, Medicare A and B is effective May 1st. So let's go back to Sam here. He is now turning 65 in the month of June, and he decides he wants to go to Europe, right, for vacation. Oh, there's a table over here, Cassidy.
You can write. No, it's fine.
Okay. So here she is. My birthday's in June. Sam says, I went to Europe and I got back in October. Remember that 7-month period, initial enrollment period. You can enroll over a 7-month period, which starts 3 months before your 65th birthday. So he goes to Europe, he comes back in October and says, I forgot to enroll in Medicare, I have to go down to Social Security and enroll. The Social Security rep is going to say, sorry Sam, you've missed your 7-month initial enrollment period here. It's now October. So Sam's like, well, when can I enroll again into the Medicare program? You have to wait till the general enrollment period, which happens January through March of each year. So Sam's like, I have to wait till January, and you have till March 31st to enroll, and it won't be effective until July 1st of that year. So all of a sudden, he's like, oh goodness, so I have to wait. If the government decides, you passed 12 months and you did not enroll, 10% goes on top of your premium. So if Sam doesn't enroll until he's 70, how many years went by? He's retired, remember, and has no other group insurance, but 5 years went by. What's his penalty now? 50%. 10% for every year. If he doesn't enroll until he's 75, that's 100% penalty. If he doesn't enroll until 85, that's 200% penalty. And once you're assessed a late enrollment penalty, it doesn't go away. It stays on your record for life, and it's always applicable on your Part B premium as long as you're enrolled in the Medicare program. So there are situations here where somebody might decide, well, I'm not going to retire at 65. I'm going to continue to work. Plus, what's important is you have group insurance. For an employer group that has 20 or more employees, which, you guys, more than 20 in the room. Yeah. So as long as you have this combination, you can go down to Social Security and say, look, I'm going to continue to work. I recommend you go down to Social Security and just tell them what you want to do with Parts A and B at age 65. If you don't do anything, they won't enroll you. But it's just good that they know what's happening with yourself. Are you going to work? Are you retired? Because you can go down to Social Security and defer enrolling in Part B. You don't have to pay that Part B premium because you have group insurance. But in most cases, what I'm seeing is they'll enroll you in Part A as long as you don't have to pay for it, it's premium free. They'll give you Part A, and then they'll defer Part B and say, you know, Sue, if you're gonna keep working for another like 3 years, let's say she wants to retire at age 68, she'll defer Part B at age 65, and then 2 or 3 months before her retirement date, she goes back to Social Security and enroll in Part B when she decides to retire. The government gives you up to 8 months after your retirement date to avoid that late enrollment penalty in this situation. So depending on where you're at in terms of your decision about retirement, because some of you may be double covered, triple covered, maybe you're covered under your spouse who's still working. So you have to really decide. Let's say you're the subscriber here, Sue, you're only 62, but your husband is turning 65, your dependent spouse, you see it okay? And let's say she's still working at 62 years of age. Does he need to enroll in Medicare Part B at 65? If she's covering him, let's put the neck together. If she's covering him as a dependent under her group insurance, does he need to enroll in Part B? The answer is no.
But he has to get a deferment, right?
Yeah, he can go to Social Security and say, you look, I'm still covered under my wife's group insurance and she's still working. I'd like to defer my Part B because I have group insurance under her plan. And we'll wait until she decides to retire, then I'll go ahead and enroll in Part B then. So why pay that extra $135.50 a month if you have group insurance? So if she decides to retire at age 65, retirement, he's now 68, what do both of them have to do? He has to get his B, right? Because he got A when he was 65. She needs to get A and B to avoid the late enrollment penalty. So depending on your personal situation, you can talk to us afterwards and we can walk through your options. Because some of you may be double covered, triple covered, and I have to draw this out for you. Because how many have double coverage for their spouse? Anybody? One? We'll just talk about that. Okay, so that's what the enrollment period into the Medicare program. Where do you enroll for Parts A and B?
Social Security.
Social Security. You can either do it online or go make an appointment at a Social Security office. And this is what the Medicare card looks like. It used to be where your Social Security number was right here. The government decided no more Social Security numbers to protect you from identity theft. So all Medicare cards are now going to have an 11-digit Medicare beneficiary indicator number. You have to memorize it. So this is going to be, you're going to have an 11-digit number assigned to each of you. And it'll tell you when you enroll in Parts A and B. So some of you might just have a card with Part A only, because you might be like Sue, where you decided, I'm going to keep working another couple years. I don't want Part B right now. Now there is one little caveat here. The first bullet here says, if you're already getting benefits from Social Security, this is Social Security benefits, you'll be automatically enrolled in Parts A and B on your 65th birthday. Because some of your spouses may be retired a long time ago and decides, I want to collect my Social Security benefits early at age 62 or 63 or 64. This Medicare card will arrive in the mail automatically, and you're like, I didn't enroll in Medicare, why did I get this in the mail? So if you're one of those that get it in the mail, but you're covered through your spouse, in the back of the card it says, if you do not want Part B at this time, please return the card to us, and we'll disenroll you in Part B until you decide to do so. Anybody receive their Medicare card automatically by any chance? No? Okay, good. So then there's Part C of Medicare. So let's just recap. What's Part A of Medicare? How many quarters do you need for free, Part A?
4.
Which is how many years? 10 years of Medicare. And what's Part B?
Medical insurance.
Everything else.
Everything.
Is there a premium?
Yes.
Based how many years to look back?
2 years.
2 years. Got the test ready for later. So now there's Part C. What's Part C of Medicare? Did somebody say drugs? Okay, so my marker. So let's pretend we're all like Sam now. We're 65 and over. We're enjoying our retirement. We're all retired. We have our red, white, and blue Medicare card. We're paying 0 for Part A, but we happen, we have to pay for Part B. So Sam's like, okay, I'm retired, got my Medicare card, I'm done. Well, you're not quite done yet, because we need to know, how do you want to receive your Medicare benefits, your Part A hospital and your Part B medical insurance? And he's like, well, what do you mean? What are my options? Again, this is education on all these acronyms out there, because you're going to be bombarded with mail and you're trying to figure out what's this Medicare supplement, Medicare Advantage. So you have to know what the difference between Medicare supplement and Medicare Advantage. So Sam, let's say you're pretty happy, but first option is you can use your red, white, and blue card under what they call original Medicare. That means Sam can go to any doctor in the United States that accepts Medicare patients and says, here's my red, white, and blue card. Dr. Jones, do you accept Medicare patients? He says, yes, come on in. If that's all you had in terms of health insurance was your Medicare card, you have deductibles and co-insurances that you have to pay first before Medicare kicks in under original Medicare. Like Part A is hospital, so you might have, you have to pay $3,000, like a $1,300 deductible before Medicare kicks in. If you're hospitalized, that's only for the first 60 days that you're in the hospital. But if you're in the hospital more than 60 days, you have to pay like $399 per day under original Medicare. And if you're in the hospital more than 90 days, it's like $600 plus a day. 90 to 150 days per day. These are per day. If you have to go see a doctor, Part B of Medicare, right? Medical insurance, you have a $183 deductible. Plus, every time you see the doctor now, the doctor bills you 20% of the doctor's bill. So that's where you hear Medicare pays 80%, you pay 20%. They're assuming that that's all you have in terms of insurance is the red, white, and blue Medicare card. So Sam's like, golly gee, I like the idea that I'm able to go to any doctor, but I can't afford these deductibles and co-insurances. So you can enroll Sam into what we call a Medicare supplement plan. They're also called Medigaps. Just to confuse Sam a little bit more, those are plans A through N, so don't worry, you'll get a lot of things in the mail saying sign up for a Medicare supplement plan, or you're watching TV, sign up for a Medicare supplement, Medigap plans. So that's another premium that you have to pay if you decide to get into a Medicare supplement plan on your own. So Sam's like, what's my other option? We're getting to the point of describing what Part C is for you. So you can assign your Medicare over to private insurance companies that offer what they call Medicare Advantage plans. And these are private companies that offer PPO plans, HMOs, and there's a lot more acronyms coming up here in a couple slides here. And that's what's called Medicare Advantage plans. That's what Part C of Medicare is. If you decide to lock in your Medicare with a Medicare Advantage plan, you're signing up for Part C. And Medicare Advantage plans are available through CISC, or if you don't want to be affiliated and you want to drop your group insurance, you go on your own, and there are plenty of Medicare Advantage individual plans that are out there. And again, you'll get solicitation so much in the mail, about this high. And you have the right to look at all this, but what you want to focus on is because you're under CISC, you have the Kaiser Senior Advantage Plan available here, and there's also the Blue Shield, no, not Blue Shield. You have the Senior Advantage Plan. And then you have a Medicare Supplement Plan through CISC called Companion Care from Anthem Network. So we have the Companion Care here. Companion Care, which is a Medicare supplement under CISC. But you can have your own on your, on your own, or you can have a Medicare Advantage on your own. But today we want to focus on what's available to you today, which is a Senior Advantage Medicare Advantage Plan from Kaiser, and you also have an Anthem Companion Care Medicare Supplement Plan through CISC, which is under the PPO. And you also have the PPO, the Coordination of Benefit, through CISC. And what that is whatever your PPO plan doesn't pay, Medicare pays. So there's options for you. Since you're under the CISC umbrella, you have group insurance. A lot of people, when they retire, they don't have group insurance. They don't have the Joint Powers Authority pool that you're in under CISC, and they have to buy their own supplement or get their own individual plans that are out there. So just know that you have rich benefits through CISC, the Self-Insured Schools of California. Okay, so you know what Part C is. So again, a little bit more information on Part C. Part C equals Medicare Advantage. Medicare Advantage plan covers all the services under Original Medicare. With most plans, medical benefits and services are covered in addition to Original Medicare, such as eyewear, Silver and Fit gym membership, stuff like that. And you have to have your services under the network of providers that under that Medicare Advantage plans. These are just different types of Medicare Advantage plans that are out there. There's an HMO, HMO POS, more acronyms for you, PPO plans, private fee-for-service plans, and Medicare savings plans. But the most famous ones out there are PPO and HMO Medicare Advantage plans. When somebody decides to assign their Medicare to a Medicare Advantage plan, the government pays that company, CMS, pays a capitation to take care of SAM. So, for example, for Kaiser, we offer Medicare Advantage plan, we take on the risk to take care of SAM. That means that we now have to take care of SAM's Part A hospital insurance, Part B medical insurance, and now we're going to get to Part D as in drug, in terms of your prescription drug coverage. And there is additional premium that you have to pay for this, the plans that you're paying for, or this district might pay for it. No, they don't. Okay. So there's that Part B premium that you have to pay first, which is your Part B Medicare premium. And then depending on which plan you decide to enroll in, you have that additional premium that you have to pay. Okay, the last part of Medicare is Part D. Can you imagine Medicare was signed into law in 1965, and only in 2006 did they add Part D as a drug under the Medicare program. So what is Part D? Slide 13, Part D is your outpatient prescription drug coverage. So Sam's like, well, how do I enroll in Part D? I have A and B, but how do I go to Social Security to enroll in Parts A and B, but where do I go to enroll in Part D? Well, depending on which way you go with your Medicare, okay? So All of the CIS plans that are offered to you includes Part D. You're automatically enrolled in a Part D prescription drug plan, so there's no need for you to enroll in a CVS or a Walgreens Part D plan, because if you're enrolled under one of the CIS plans, Medicare plans, you have prescription Part D already included in those plans. Because again, you're going to be solicited with so many things in the mail, you might accidentally enroll in another Part D plan. It'll disenroll you from your CIS plan, because you can only be enrolled in one prescription drug plan. In a lot of Medicare Advantage plans, such as the Kaiser plan, it includes Part D. It's included. Once you're enrolled in that plan, you're already enrolled in Part D. But there's one more thing about Part D. Under the Medicare program, if you're deemed as a higher income earner reported in your income tax return, remember that Part B is in Bravo, where if you're above $85,000 as a single or above $170,000 as a couple, see how it's above that mark, you go up a little bit on your Part B premium. So if the government deems that you're higher than $85,000 as a single and higher than $170,000 as a couple, not only are you paying a higher Part B as in Bravo premium, the government wants another $12.40 up to $77.40 from you, because you're deemed as a higher income earner. And again, this is under Medicare. You pay this extra Part D income-related monthly adjustment premium directly to the federal government. So remember that letter you received in December telling you your Part B premium is this amount? For those of you that are higher income earner, there'll be another line item. It says Part D IRMA minus $12.70 from me. So plan your retirement. Remember, there's extra funds that you need to put aside for Medicare. But most people will not pay this Part D IRMA because, once we retire, we're not going to make as much anymore. So the majority of people in the United States don't pay this, but just in case you end up higher than what's on the table, you're going to question, do I have to pay this extra Part D IRMA? And the answer is yes, you have to. Now, once retirement comes around, but you need help to pay for your prescription drug, the government will help you out by offering you what they call a low-income subsidy program. You go back to Social Security office and try to apply for the subsidy. Because sometimes when spouses pass away and you're on your own and you happen to be taking more prescription drugs than you ever saw happening, you might need help. The government is there to help you under the low-income subsidy program. But you have to have very limited resources, really limited resources for the government to help you out. One last thing about Medicare is that all Medicare Advantage plans now in the country are being audited by CMS. That one, remember in the beginning, CMS administers Medicare. All Medicare Advantage plans are being audited based on the quality of care that's being given to SAM. They want to make sure, number one, Kaiser, are you providing preventive services to SAM the way you're supposed to? How are you managing his chronic illnesses? Are you prescribing the right prescription drugs? How fast are you answering phone calls when they call your company? And they survey our members. And it's based on a 5-star rating. Just like hotels, when you travel, you want to make sure that you're going to stay in a hotel that's going to take care of you. Same thing, as a Medicare beneficiary, you can now ask questions before you sign a dotted line. If you're going to sign up for a Medicare Advantage plan, what is your star rating? And they can tell you. Just a little plug on Kaiser. We have been rated 5-star 8 years in a row now under the Medicare Advantage plan. So a little clap for Kaiser there. So these are numbers that's available to you. If you want to check your quarters, you can call Social Security. If you want to just call Medicare and ask a little bit more about what you learned today, or there's HICAP that's available, which stands for
Health Insurance Consumer Advocacy Program.
Health Insurance Consumer Advocacy Program. There's HICAP available for you around the whole state to help you go over your options. Because some of you might decide, I'm going to retire and live in Texas. I've been a Kaiser member all these years. You go back to CISC and say, what are my options if I'm moving to Texas and I was a Kaiser member? Kaiser's not available in Texas. CISC is there to help you figure out what other options you have. It could be the companion care or the PPO plan. So now, let's open it up for questions. Yes?
Can we also state that you don't have to call Social Security? You can actually go online and download your information. It's easier to do that way if you want to check your quarters, because otherwise you're going to be on the phone for like 12 hours. So just want to let you know that.
Good point.
Yeah.
Yes, ma'am.
So if I retire before 65, am I still a part of CISC?
So the question is, if I retire before the age of 65, am I still part of CISC? So Lola, the question is, I'm retiring at 60 years of age. I have options through CISC, correct?
Yeah, so, the short answer is yes. So as far as CISC is concerned, as long as a retiree meets the criteria of being a service retiree of the district, a CalSTRS retiree, a CalPERS retiree, as long as you are a retiree, not someone that worked at the district for 3 years, all spent your whole life in private sector and now you've stopped working. You have to meet a criteria. We allow you to continue on the coverage. Now, it always gets a little bit tricky because there are various agreements of the district and who is contributing to what and for how long and is it all self-pay, and I always have to defer those to my friend Ron here. But as far as continuation of coverage, as long as you meet the criteria of being an actual retiree, as long as the premium is being paid, you may continue on.
And we have slides on CISC that we might have time to go over?
I'm probably going to abbreviate and just go over a couple of things.
Any questions on the basics of Medicare before I give it to CISC? Yes, ma'am.
Part D, drugs.
Uh-huh.
I've heard some rumors about that you have to apply or you don't have to apply. Is there something,
Okay, for Part D.
only Part D, like somebody got penalized for not enrolling in the drug? I can't remember what it
Yes,
was.
so,
They're rumors, so I'm just,
well, there is also a late enrollment penalty for Part D. What the government wants to make sure is you have Part D or credible coverage at age 65 and over. So for those of you that are, Sue went away, but for those of you that are working past the age of 65, your prescription drug benefits through your employer group now is equivalent to Part D. It means credible coverage. Sometimes you get these credible coverage notice through open enrollment telling you, hey, your prescription drug benefits at age 65. It's creditable. So when you do retire at 68, the Social Security rep is going to say, hey Lola, did you have group insurance coverage while you were between 65 and 68? And did you have prescription drug coverage that was creditable? So you have this form come back to Ron or your district and say, or your school and say, can you prove to them that I had credible coverage? Because that penalty, that not only the 10% late enrollment penalty for Part B, there's also that 1% for every month that you did not have credible coverage for Part D.
So my guess is that the person didn't enroll in Part D to begin with, and then later decided that they wanted to, and that's probably the problem.
that's what I'm hearing. Okay,
Yeah.
that's it.
Yeah.
So they got penalized.
Penalized, yeah.
Yeah.
And there is what they call, they can fight that late enrollment penalty for
Appeal.
Part D. It's called a attestation, where they have a form they can fill out and send it to Maximus, which is a third-party administrator under CMS that looks at it and says, hey, I'm sorry, I didn't even know I had to do this, but I did have credible coverage all these years. Sometimes they don't answer letters to prove that they had credible coverage, but they can fight it and try to waive that penalty.
I had been in conversation with Ron about this, and he said he was going to ask you to do a side-by-side on it, comparing the Kaiser Medicare Senior Advantage Plan, a single $374 a month, versus the regular individual Kaiser Senior Advantage Plan, $106 a month, you know what I'm talking about?
Yes.
So, and he thought that possibly the first plan is a richer plan. And I'm kind of wondering, how do I compare the two? Because there's quite a difference in the premium.
Yep. So,
So her question is, I heard Kaiser offers a senior advantage plan directly for $106, while the one under CIS is $374. What's the difference between the two plans? Well, first of all, your plan through CIS is richer, meaning your out-of-pocket cost when you seek services is less than you would get on the individual plan. And we're going to try to bring that up here in a minute.
It would depend on how healthy I am, what prescription drugs I'm on.
Yeah, so
things
let's
like
look
that.
this is an example of comparing somebody who lives in Marin County at $106 versus what you would get under the CIS,
and they have the $10.
and you have this plan right now, $374. So the first thing you want to look at is the out-of-pocket maximum. What out-of-pocket maximum means is once you go in and seek a lot of services and your maximum for that benefit period is $1,500 under the CIS plan versus $6,700 on the individual. Once you hit the out-of-pocket maximum for that benefit period, you no longer have any co-pays for that year. But you can see there's a big difference on the out-of-pocket maximum. That's one. The other one is,
Maria? Oh, sorry. No, you said you no longer have any copays for the year, but that doesn't include prescription
it
drugs.
doesn't include
No.
prescription drugs.
Yeah, I just noticed that.
Yeah.
So you have to do
Okay, so if you have to see a doctor, $10 versus $35. You're like, okay, what if I have to go to the emergency room? $50 versus $90. Urgent care is $10 versus $35. And now when you're hospitalized, no charge under CIS, but now it's $285 for the first 7 days that you're in the hospital. So $285 per day times 7, that's your out-of-pocket cost for hospitalization versus no charge under CIS. No matter how many days you're in the hospital, under CIS you pay nothing over here. Now, what if I have to get surgery done? Well, $250 out-of-pocket versus $10. What if I have to have lab work done? You know, my dad, I swear, they took so much blood from him. It's like weekly, sometimes bi-weekly. So you have to think about your out-of-pocket costs. It's no charge under CIS every time you take a lab or x-ray or CT scan. But here you have to either pay $30 or $40 every time you go in. And then you have durable medical equipment, which is like wheelchairs and stuff like that. No charge under CIS, you might have to pay 20% under this plan. And the biggest ones I just want to point out is skilled nursing is a big one. Under the individual plan, you pay nothing for the first 20 days, but then after 21 days that you're in a skilled nursing facility, you have to pay $100 per day versus no charge for 100 days here under the CIS plan. Meaning, you know, right after hospitalization, maybe a broken hip, the doctor says you have to go to skilled nursing to get stronger, and you have to get ready to pay more than after 20 days, $100 per day under this plan. And the other big one is the prescription drugs. I don't know if you've heard what they call that donut hole. What that means is, here under CIS, you're always predictable. You're always going to pay $10 for a 100-day supply for generic drugs, $20 for brand name drugs for 100-day supply. Always predictable, 10, 20. But here, it depends on the drug that you're taking. Because on the individual plan, it has a 6-tier drug. You can pay as little as $6 for every 30 days, It could be $47 every 30 days, it could be $100, it could be 33% of the drug cost. And after your out-of-pocket cost reaches $3,750, meaning the actual drug cost and your copays, they're adding it up behind the scene. Once it reaches $3,750, you enter what they call the donut hole or the gap coverage, where you have to pay 25% of your drug costs if you happen to be taking any brand or specialty drugs. So just be aware that yes, you have this option, but once you drop out of CISC, you can never go back to it. You're now on your own with an individual plan, and just think about your costs on a product. But you know, for somebody who's healthy and not taking any prescription drugs, hey, you're saving a lot of money every month. 106 versus 374.
And if they're taking generic prescription drugs.
Yeah, you don't have the donut hole.
And I think it's really important to remember when you retire here and go, oh, I'm gonna go on the, Kaiser also has a $0 plan, or the 106. Once you leave, you can't call Ron a year later and go, you know, that plan didn't really work out for me, so I really wanna go into CISC. It doesn't work that way.
You have
So,
one chance.
You have one chance, so you really need to really weigh your options on that. It's very important that you look at that.
So if you retire at 62 and these apply to 65 and older, does that mean that you have to take gap coverage?
No, actually what is offered to retirees under age 65 are just the same benefits plans that are offered to the active employees and at the same rates
Oh, yeah, how long?
until age
Until
65. Yes,
Awesome.
at
And then
Medicare.
that includes your dependents as well. So it's basically like Cobra without the 4%?
The cost that we are billing the district continues, however, I don't know, I can't speak to what the district contribution is, if any at all. As far as the amount that we bill, whether it's, $1,500 today and the district is funding, $1,300 of that, that's where you have to look at it. Yeah.
Could we get a copy of this?
Question is, can they get a copy of this?
I think Ron
I
has
actually have
time.
it posted on our website.
On the
So
website?
I can send you a link. I'll send everyone that signed in, I'll send a link to this after the
So
presentation.
what's
And
the
I think the sign-in sheet is missing a few names.
And
I'm
there's
gonna
another
link-
one over there.
Oh, okay, just make sure you sign in
What's
before you
the
leave.
SCR $25 and the SCR $10 columns? I
So
missed
districts
that.
have a choice in offering either the $10 plan or the $25 plan, and very few districts offer the $25 plan,
Do we?
you do not. Yeah,
Oh.
it's the $10 plan.
Okay, so don't even look at that column.
Yeah, don't look at this.
Right.
Okay, thank you.
And it actually should say NCR, but that doesn't even matter. No one knows what that means
And what
anyway.
about dental?
So, with respect to the dental, again, there's a possibility of continuing coverage. It all is described it's best to talk to Ron.
Past 65? Oh, so,
It's best to talk to Ron.
okay,
Yeah. So,
but not in here.
no. Yeah, so, I wanted to, if you don't mind, Maria has done a fantastic job, as she always does. I've seen this lots of times, and I nearly always learn things. We'll skip, I'm gonna skip this altogether. We'll just go back to the blue slide that we were on. We're doing a tour, so there's a lot of different presentations, sorry. You guys are on the first bus stop. What I wanted to share with you is just a little bit of maybe a recap in the final few minutes of just some situations that have come up with other retarees, other people facing retirement, and maybe just share some of the lessons that we've learned along the way. Okay, so Maria talked a lot about timing, right? How important it is to time it well. The vast majority of heartbreaking situations that I have found myself dealing with are people who did not understand the timing. So if you take nothing away from this meeting at all today, other than there are lots of letters involved with Medicare, and I've got to remember what those are, know that timing is critical. So once you retire, or once you're approaching retirement, particularly if you or your spouse has deferred Part B, don't forget, you know, that you got this letter from Medicare that I'm sure you stuck on your coffee table and said, okay, I think I'm gonna leave it there until I retire. Well, of course you didn't. But I have had situations recently where a gentleman retired. His spouse had Medicare Part B due to disability, or she had eligibility for it. She deferred it 12 years ago. Now he's retired 2 years ago, and he didn't realize that it was time for him to enroll his wife in Medicare at the time that he retired. And I told him to beg and plead and ask for a supervisor at Medicare, and to no avail. He now will be stuck. I think he's going to be either 3 or 4 years of late enrollment penalties on his wife because he missed that window. We sometimes have folks that, you know, there's two different groups of us, right? There's the ones that are like, yay, I'm retiring, and you're like, when? And they're like, 16 months from now. And then you have the other ones that you see them slinking out the door with their box and sort of waving over their shoulder. Well, if you're the slinking out the door with the box variety, please know that you still have to plan ahead for Medicare A and B. Especially if you're working post-65, you've got to make sure that everybody that you plan on having enrolled in any kind of insurance, whether it's Kaiser Senior Advantage, whether it's an individual plan, you know, these $2 or $3 premium plans that they have through Humana or whatever you've got to do, whatever your plans are, you're probably going to want to have some health insurance post, you know, retirement, right? Every option is contingent on you and your spouse, if you or your significant other, having both parts of Medicare if you are eligible for Medicare A and B. That means usually at age 65, but it also can be for some folks that have are under age 65 and have deferred a part of Medicare due to active employment, and that person was eligible due to disability. So if you take nothing away, just know I've really got to keep this timing straight on Medicare, or else I'm going to get myself into trouble. Susan, Maria, everyone noted that if you decide to go to the individual market, you will not have an option at a later date to return to the CISC plans. That is very true. And so what I have told people before is, gosh, you know, great for you that you're studying ahead of time, except for you. The clock is ticking on you, right? But most of you are kind of learning ahead of time, so you can kind of think about, okay, how is this all going to work? But sometimes people are like, oh, I didn't know that there was this much involved. I didn't know I had to make these types of decisions. Worst case scenario, as long as you can afford to stay on the CISC plan, stay on the CISC plan until you're sure. You can always drop into the individual plan later, but you can't come back. And I don't say that to scare anyone, it's just that I often will see people who, you know, maybe they didn't expect to retire, maybe they just didn't think it was going to be as complicated as it was. Whatever the reason, they didn't know that they needed to hurry up and get their, you know, get these decisions made, and now all of a sudden maybe they're facing a health issue or they have a dependent that's facing a health issue. I always just say, keep that in mind. You can always hang out on our CISC plan for a while and then move to the individual market at a later date if you decide that that's going to be a good decision for you. Everybody is different. What works best for you doesn't necessarily work best for your neighbor. I've seen lots and lots of people that this individual plan, you know, if you're like my my dad, who, you know, he can pay cash for his prescriptions for about $400 a year. He takes practically nothing and they're all generic. Great for him, you know, he's 76 years old and rocking it, doing great. But other folks, like my in-laws, you know, they have diabetes and COPD and all these various other things, and they take lots and lots and lots of brand name medications, injectables, everything is very complicated, and they hit the donut hole, that coverage gap every year. If they had an option to purchase, I would certainly encourage them to do so. So
This used to be 100%.
yes,
Wow.
it's gotten better.
And gotten better.
So just keep in mind that just because, you know, so-and-so is doing great on this plan, it doesn't necessarily mean that that's good for you. I tell folks over and over and over, it's all about the drugs, really and truly, when it comes to individual versus group plans. If you are out there looking at just the medical, you'll say, heck, why wouldn't I save the money and go to an individual plan? I don't see that much difference. You'd be absolutely right. The difference is in the prescription drug benefit. Prescription drug benefits under CIS are unparalleled, whether it's Kaiser Senior Advantage or through our PPO options, our Medicare supplement options, in that you have no coverage gap. You cannot buy that out on the individual market. And for some people like my dad, who cares? For other people like my mother-in-law, I really care. So just kind of keep those things in mind, because it's obviously it's a big cost difference, but you know, it may be worthwhile in the end. So, oh yeah, we'll stay around for as long as you guys need.
The 278 versus the 374 plan, which one do?
Well, we here at Murray Community College, it's the $10 plan, the 374 that's offered currently. I tell you what, I personally think it's sort of crazy that you know, more people don't offer one versus the other, because to me the $25 is a little bit it's less expensive. However, I know that the vast majority of districts where there are retirees, they typically always want this $10 plan. It's something that we could look at in the future, but currently the plan that is being offered is the $10, not the $25 plan. Big difference here is the hospitalization, that $500 deductible on hospitals, or $500 copay, I'm sorry, on hospitalization, and prescriptions are a little bit less rich, a little bit higher copays. But we could talk about it in the future if you guys wanted to swap it out and do the 25
Okay,
instead
but
of
at
the
this
10.
point, you can't
10.
swap it out.
Yeah, the 10 is what's being offered today.
So I have a story really quick. My dad had this, just the original Medicare. He was very stubborn. I kept telling him he needed like an Medicare Advantage plan. He had heart surgery. This cost us a lot of money. He's having heart surgery on Wednesday. I finally got him to get a Medicare Advantage plan, so I don't have to spend a lot of money. So just know that this is a lot more out of pocket. You know, this, you have to get D with this one. These ones, you're good. Okay? So that's the way to look at it. So ask us questions. We are here. We are super excited. Oh, thank you so much. I'm so scared because they don't know what it is
Okay,
yet. So.
I'm going to go ahead and say you're dismissed. I don't want and I'll stay around for questions because I know we're 5 minutes past. So, and let's see, I'll have Angela and Cassidy also come up, and we can all do our best to answer your questions.